Nursing students, time to talk. Welcome to the Real Talk School of Nursing Podcast, Season 4, Episode 5. I am your good and faithful host, Michael Smith. Thank you for continuing to subscribe to the show. You can support the show directly on our Patreon account at www.patreon.com/realtalknursing and gain patron benefits such as early content, shoutouts, special swag, and more. You can also write into the show at realtalknursing@gmail.com or use Facebook Messenger or contact us through Instagram or Twitter to share your experiences, ask questions, and give feedback. Thank you for supporting our friends, affiliates, and sponsors, and thank you to everyone who started following us on Instagram, Twitter, and Facebook. More listeners means more and better shows. Make sure to share the episode with classmates and especially underclassmen and cohorts. Let's give a hand up to those who are coming behind us. Welcome to our community of fun, engaged, and supportive nursing students and nurses. Don't forget to reach out and tell us if you have any announcements for graduations, good grades, difficult tests, friends you want to help congratulate, and your announcement will be featured on the show. If you like the show, the Real Talk School of Nursing podcast is available on iTunes, Google Play, iHeartRadio, Libsyn Web Player, Stitcher, YouTube, Spotify, and SoundCloud. So go to wherever you download podcasts, subscribe, rate us, review us, write into the show, and smash that subscribe button. Remember to leave only 5-star reviews because that's the only ratings that count to get us noticed by more nursing students. Joining us today is Nurse K. It's going to be a fun show. Let's get it going. See, we're already off to a bad start. This is you are getting an inside look as to why Instagram is stupid because you see like the perfect shot at the end. You guys hear the perfect-ish episodes and stuff like that after tons of production and post-production work, and you don't hear any of the ridiculous, dumb, stupid stuff that I do. So our guest today, Nurse K. Let's try this again. Okay, so talk to me about your. Let's start off with kind of an introduction and talk to me a little bit about your educational background and where you started. So graduated high school and then went to college. So what did you do for your undergrad?
Well, Michael, for as long as I can remember, I wanted to be a doctor. From my earliest recognition of a career and lifestyle ideals, that was my thought. So after high school, even in high school, I did focus on medicine and anatomy. I had some opportunities to take some courses in cadaver dissection. So we dissected cats and things like that, and I was just fascinated. So naturally, I went to college and focused on biomedical sciences, which was my college's version of pre-med studies. I did well. I loved every minute of it and planned on medical school. When I was in college, I guess I had a relationship that sort of got in the way of my career plans. And this person's family they were all lawyers. And right.
Oh, good.
And so I started looking at law school and thinking, well, maybe I could do healthcare law. And I actually had a family situation where a family member of mine had a legal issue with their hospital that they were employed at. And that really affected me as a young adult. So I started looking more seriously at law school. And as I was preparing all of my graduate applications and deciding where I wanted to go and what I wanted to do with my life, I sat for the LSAT, which is the entrance exam for law school, and I did well. So I thought more, and I was planning to take the MCAT, decided against it because I did well in the LSAT, and just decided that I was going to go to law school and focus on healthcare. So that's what I did. Right. So I knew.
No big deal. Just sat for the LSAT, did well, got into law school. No big deal. No big deal.
Yeah. Well, I knew right away, within the first week right away, that it was not the best fit for me, that I was not passionate about it, but I forged ahead and focused on healthcare law in law school with an emphasis on medical malpractice, ethics, and healthcare mediation. I really, really enjoyed the healthcare mediation courses. Learned a lot about how doctors traditionally have had a really hard time saying, I'm sorry, and how essentially ethics committees have stepped in and helped doctors learn how to say, I'm sorry. I thought that was very fascinating. With my combined backgrounds of medicine and law, I think that's where my fascination came from with that, and just having had the prior lifestyle of really putting doctors on a pedestal, and now being a law student and seeing that they really were just human and had a hard time saying I'm sorry because they had been placed on this pedestal in medical school. Um, so I graduated from law school, passed the bar, started practicing. Didn't get into healthcare law practice because I found out very quickly that it's very hard as a new law grad to get into a health law practice. You essentially have to work in private practice for many years, make your way and make a name for yourself, and then perhaps someday get into a health law firm, which didn't exactly make me happy.
So without giving anything away, other than the fact that I called you Nurse K at the beginning, you did eventually go to nursing school. Do you think there is something similar in that? When you first became a lawyer, you were somewhat limited in what you could do, since you took the first thing that paid you a salary, essentially, and then with the promise of something better later on. I mean, did you kind of feel that way as a new nurse as well later on?
You know,
I mean, did that experience kind of set you up in order to be more accepting of
definitely.
opportunities that may get you there but aren't there yet?
Definitely. I think I was a different person when I graduated as a new attorney versus when I graduated as a new nurse.
Mm-hmm.
I went back to nursing school, or I started nursing school a little bit later in life after I was married and had children. And I think I just had a little bit of a different outlook on life. And I was more patient and prepared to advance toward my goals in a stepwise fashion rather than just jump and, make this leap and just expect to be granted whatever I wanted.
you're as a parent. So one of the things that that Kay and I have in common is that we both have twins, and we have twins about the same age, and so we were both kind of going through nursing school and through this process more or less at the same time.
Yeah.
I mean, my kids were 2 when I was going through nursing school. Mine was a 2-year program, and yours was about the same, right?
Yes, I did.
Or was yours an accelerated BSN?
I did an accelerated BSN, and my children were about that same age.
So 18 months or 16 months was yours?
Yep.
Okay. Yeah, that's man. It's so intense for such a short amount of time, and then being a parent on top of that, especially with little kids, was like one of the hardest things. But if I had done that prior to having kids, I'm not sure that I would have made it through school.
It's interesting.
Because I mean, you're force fed patience because you have this little kid in front of you that doesn't care and doesn't deserve. I mean, if there's anybody in the world who deserves to be treated nice all the time, it's a baby, or a 2-year-old and stuff like that. So you really can't get mad at them for a lot of stuff because they're 2. And so it forces you to be really patient and stuff like that. So that's interesting. So you've been working as an attorney for how long now?
Oh, approximately 8 years. And while I went to nursing school, I worked a lot less. I kind of took a hiatus from the practice for a little while, and I had actually not been working in a law firm format. At that time, I had been working in healthcare philanthropy, so it was a little bit different type of stress. But I was essentially doing legal, medical, marketing, a lot of things in one, and I really did enjoy it. But it gave me some flexibility to have my nursing degree and do it in a fashion that I could both work and go to school and support my family.
But what was the push? I mean, I don't understand how did that come? How did you get to the point where you're working? I mean, you're having probably by all accounts, knowing you pretty well, that you're probably killing it as an attorney, as a lawyer. You're probably just I mean, you're doing well. So what was the push? Because, uh, I mean,
What?
what made you want to do something else?
Yeah.
Not just instead, but on top
No.
of what you were doing.
Well, I just couldn't let go of that childhood dream, I think. I happen to be a somewhat stubborn person and very goal oriented, and I felt like there was this huge abyss in my life, and it was just emphasized every time I would meet with or talk with a nurse or a physician or even anybody in patient care management as part of my career role. I did that a lot, and anytime I would have those meetings, I would be just beaming throughout the meeting and just giddy with all of this information and the back and forth communication with somebody who represents patient care. And then I would leave the meeting and think, why am I not doing that? Why am I not there? Because that was my passion was just so strong, I guess,
Hmm.
during that. And so it just made me reflect on life a little bit more and think about where my career could take me. And nursing school seemed like a pretty logical option because there are a lot of options for nursing school. And I found a hybrid um, program that was only 15 months from start to finish. And it was hybrid being a lot of the time was online, some of the time was in class. And so I was able to have a family and work and go to school all in one. So that
I don't
seemed to
even
make
see
sense.
how. I don't even understand how that's possible. I mean, the. I mean, because I know I'm pretty familiar with the program you went through. It's not a easy program. I mean, it's. I mean, it's academically very rigorous. It's you have. I mean, I know people who've gone to that program. It's intense, and you're like, oh well, I could just do it, and I could keep working and do it. Like,
Well,
well, like, oh my god, you have to be like one of the biggest brain people I've ever met in my life. And you're like, oh yeah, I could have a career. You kept working, and it's not like most of us who went through nursing school were like holding on by the skin of our teeth, like by the edge of our fingernail while working as a CNA or as a waiter or something else like that. No, 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 no. Nurse K,
well,
you're working as a
uh,
lawyer in healthcare philanthropy. You're a fully fledged attorney. Uh, you have twins at home. Yeah, this is crazy. How
well,
did that? Uh, how is that even? How's that? Ugh.
there were some sleepless nights. I have to say, there were some nights where I was awake studying until 3 in the morning for an exam that was at 8 a.m. the next morning. But that really wasn't that much different than law school for me. I think law school kind of prepared me for rigorous academic
Hmm.
strain and stress. And I have to say that nursing school was very difficult. It was. I will give it credit. It was not easy. The accelerated program was very accelerated. We would go, I mean, I specifically remember cardiology, our cardiology unit, because I like cardiology. And I think we had 8 days between starting the cardiology unit and the exam. 8 days. And none of that included any class time. That was all strictly online. You were expected to post to these online forums, which were horrific. A total time suck and not helpful whatsoever. And not only that, but read the entire unit, which was 400 pages or
Right.
something like that, and then know the pharmacology, know the comorbidities, know treatment, and be able to ace the test. Because I think our A in the grading format, you in order to get an A, I think you had to get like a 96%.
See, you guys, you probably see ours was we didn't try to figure out like what an A versus an F is because it was 83%. It was like anything other. It was if it was 82.99, that is not 83. Therefore, it's a fail.
Yeah.
Like you could be a half a point away from passing the entire friggin' thing, and it's like, nope, didn't make it. Good
Oh,
luck next year. I mean, that was it. That was it. I mean, luckily, most of the classes, if you didn't do well on an assignment or a test, more likely a test, you had other assignments kind of help you out. So that was at least there, but it's interesting that you guys the academic perspective of saying, okay, an A is 96 and up, a B is 92 to 96, a C is 87 to, whatever it is, all that academic levels, and then you go, okay, well, failing is, I mean,
I just knew that I had to have a really good GPA because I knew that after nursing school, I wanted to have the opportunity to go on. So I needed to shore up my resume early, to decide if I wanted to go to nurse practitioner school, PA school, nurse anesthesia, or perhaps even medical school.
we'll do it. We're at kind of a natural pause, so let's do a quick break, and then when we come back, let's talk about kind of some of the other influences and stuff like that in your life that kind of drove you towards nursing school.
Patience. What is that? Who even has time for that? PIE is P-I-E. Patience in everything. It's a simple yet difficult, yet powerful thing to learn. Think about the last time you were impatient. What came of it? How patient am I with others? How patient am I with myself? How patient and kind am I with the trials and unexpected turns in life? Am I patient and fully aware of the blessings of each day? I've been given a gift, be it fruit or life. It's up to me to choose how to use it. This is a book of short essays on life through something as simple as pie. Here's Coletta reading Pieology 101.
Pieology 101, the synchronicity of pie in life. How awesome to ponder how our Creator has put our individual ingredients so carefully together. Yet we get to choose our finishing touches and the temperature settings of the day. Sometimes we're hot, sometimes we're not. Every day is spent forming our own creation of self. Some days we also form a pie. Our ingredients of the day can be mixed up, nutty and complicated, or just sweetly simple. Fruits grown out of even the best soil and conditions may become bruised, but even imperfect fruit can become a pie to savor. Life, as imperfect as it may be, has a multitude of savory and sweet bites in each new day. Pie in life, filled to the brim with the fillings of our choice, oozing and bubbling over, and just so beautifully messy. Pie in life, any pie or day can end in failure and be perfected on the next. Pie in life, presented in pieces and are just what is left over, or sometimes well presented, well-rounded as a whole. Pie and life are made up of a beautiful variety of spices and different tastes. Pie and life, overworking can make it too tough. Pie and life, tender care will always produce a perfect foundation. Pie and life, dig in while it's fresh. Share that creation.
Get your copy of The Pie Letters by Coletta Hewitt in softcover or ebook from thepieletters.com. That's thepieletters.com, and buy your copy in softcover or ebook from thepieletters.com, or you can go to Amazon. Love you all. God bless.
You're listening to the Real Talk School of Nursing podcast.
It's very soothing. She should be a yoga instructor.
No, it bothers me a little bit that when she did the reading for me, when Betsy V was on, she did the reading, and it was so smooth and so soothing, and I'm like, God, you're better at this than I am, damn it. So, no, and just as a parting gift, so I gave Nurse K a copy of the Pie Letters. Go back to episode 69 to listen to the interview with Coletta Hewitt. She's fantastic. Read the book. It's just listen to the interview. Listen to episode 69. It's absolutely fantastic. I love Coletta. So let's talk about let's take a step backward. So let's talk about some of the motivations that you had to start with um, getting you into nursing school. So what were some of the influencing factors?
Well, as I mentioned earlier, the place that my career in law took me was into healthcare philanthropy. So I managed healthcare foundations and ran fundraising projects to build infrastructure or new programs for our hospitals. And in doing so, I had to work very closely with physicians, nurses, HR directors, nutritionists, the gamut. Anyone in healthcare was subject to my pleas for meetings and discussions regarding, the possibilities with fundraising. And it just kind of brought me around to working with a lot of physicians because physicians generally have deeper pockets. They generally are
What?
they generally are interested in fundraising. Some of them are interested in seeing their name in lights, and fundraising provides opportunities for those kind of things. The more I talked to physicians and nurses, the more I realized that I was yearning for direct patient care more than ever. And so I started to reevaluate where my career was going. I was very, very happy in philanthropy and I was pretty successful, but I just really felt this gap or this void, I guess, in my life without direct patient care. I even went so far as taking medical mission trips with physicians and nurses and working alongside them, even in surgery, and just, finding so much joy in that it all kind of brought me around to deciding to do something. So I actually planned on sitting for the MCAT, and I signed up for or registered for a couple of courses to retake since my pre-med days. The two courses that I signed up for were biochemistry and pathophysiology. I knew that I would have to shore up on some of those things in order to take the MCAT and actually get a decent score. And in the middle of those courses, which I was loving, I found out that I was pregnant with my twins. And so definite hard stop at that point. I had to make some life decisions, and I knew, having grown up with parents who both worked full time and were there for us as much as they could be, but not as much as I would have perhaps liked, I knew that at that point I needed to put medical school on hold and find an alternative. I wanted to be there for my children. I wanted to perhaps even stay home part-time with my children, and I knew that medical school wouldn't offer me that, at least in the first 7 to 10 years, depending on what I wanted to do.
For sure.
And so then I would have lost the first perhaps decade of my children's life, and I just couldn't justify that.
Not to mention, it might be a little bit hard to get through nursing school or medical school. I mean, that whole process, that decade of life, or at least the beginning of that life while pregnant?
Yeah, but people do it. And I guess I've always had the philosophy that if someone else can do it, I can do it too.
You could do it. Well, yeah.
If they can do it, I can do it.
Look. I've said in the podcast 100,000 times that I was the least academically gifted person in my program. And no, I'm not kidding. Like, I was literally last in my class. However, I will say, however, that my program was very rigorous, and I was surrounded by 40 people just like you. So, like, these absolute academic and brain titans, and I'm like, I can identify the choo-choo 2 out of 3 times, like, but that was the thing. So, like, and the theme of the show, as is that, nursing school isn't just about learning the content. It's managing those things outside of school that allow you to make it through school, because I wasn't the most academically gifted. And towards the end of school, it became less important to me that I got 96% and above, because it's like, okay, well, that will take me an extra 4 hours of time, to get there. that I don't have, because I can't choose to not be a dad today when I get home. I got to get my kids ready for school the next morning, and I got to do this and that, and I still want to spend time with my kids. So I'm completely okay with 87%. That was completely okay with me.
Well, and I
And
think there's something to be said about grade point average versus real life experience and ability to connect with patients.
I think there's a major. I had a young woman ask me about like nursing school applications and all of that kind of stuff, and I think you kind of get into it as once you're getting ready to graduate nursing school too, and you're like, do I put my GPA on my resume or not? And you could justify it a little bit, I think, if it's prior to your NCLEX, prior to you taking the test, and be like, okay, I have a 3.8 GPA in nursing school. If you hire me, you're not going to get delayed an extra 6 weeks, because there's a very good chance I'm going to pass the NCLEX the first time.
Yes.
All that kind of fun stuff. So there's some of that, but I think probably like you, people would look at, you're a full-time lawyer, you have this going on, you volunteer here, you did some mission trips, you did this and this and this and this and this, and they're going to look at that and go, Jiminy crickets, I don't give a crap if she had a 3.0 or a 3.7. Like, the grades on this person's application is the least important aspect of this person. And I think that's kind of the direction that I kind of justified, as like, look, I've got all this other stuff going on. I'm doing all of these other things.
Yes.
I'm living my life in such a way that grades are the least important aspect of an application. And I think fortunately, you have the ability to do all of it. So it's not a concern for you. So,
Well,
damn you.
No. No, I'll be the first one to say that nursing school was not easy. It was challenging in many ways, and juggling a family and school and work was very challenging. But I think you just have to. I think what I did is I took the time out. I tried to remain cognizant and present in as much of life as I could, especially because my children were young and I didn't want to miss out. So I would spend as much time as I could with them during the day, and then I would sacrifice sleep for my study time so that I could get it all in. And it worked. It worked generally, and I was thankful that my curriculum was 15 and a half months, because I don't know if I could have done it for 4 years.
Yeah. Well, yeah, and I mean, it's fortunate in a way that you had a bachelor's degree before, and you had the choice of an accelerated BSN.
Yes, although I do have to say that given the opportunity to do things a little bit differently, and had I been younger and perhaps straight out of undergrad, I would have happily done the 4-year nursing program, because, I guess part of that would be undergrad. Because I think that the accelerated program, as valuable as it is, it doesn't give you an opportunity to really cement that learning. It's kind of the quick learn, digest, spit it out on paper or on the computer for your exam, no matter what format, I guess, and forget it, because the next thing is looming.
Yeah, but that's the whole thing, though, is that, and if there's anything that I've learned while being a new grad, and you could probably support me on this, is that nursing school gets you ready to be a novice generalist, as Mark Klimek would say, is a novice generalist. And you're not ready. You're basically not ready for the nursing profession the day that you graduate.
No.
You have a base of knowledge that you can build on, but you're zero. You're at ground level as a new grad, because there's so much, the things that you have to learn in an ER versus psych nursing,
right,
or a med-surg unit, or a neuro unit, or a cardiac unit are very different.
Definitely.
And so you can't say that, well, I'm ready for nursing school, and if you can get through nursing school and you can put up with the academic rigor and the intense amount of time to get through that, I don't think it really matters all that much, to be honest with you. Like, I don't think it's that big of a deal if you are doing it in 16 months or if you're doing it in 4 years, because I mean the real learning, I'll say it again because it bears repeating. When you graduate and you pass that NCLEX and then you get to your first day on the job, that's the day that you're going to realize that your education is ahead of you, not behind you.
I would definitely agree with that. I think that the learning really does happen on the nursing floor.
It's amazing. It's absolutely amazing how much stuff I had to learn, or just go, or or like one of the nurses would just tell me something and I'm like, oh my God, why couldn't my nursing instructor just explain it like that? That would have saved me like weeks. So much stress.
Yeah.
So let's talk about let's move on here. Let's take a quick break and then we'll come back and let's talk about a little bit of nursing school and what life was like inside nursing school. And we're jumping around and that's okay, but let's talk a little bit about what life was like in nursing school and then new grad a little bit later. So let's take a quick break and we'll be right back.
Nursing student ground, this is Real Talk 6, ready for taxi with Romeo Papa Hotel, downwind departure. Roger, nursing student ground, taxi to 31 right via Zulu. Nursing students, do you want to become an RN and think someday you'd like to be a flight nurse? How can you make this happen? What's the best flight path to make this dream, inside the dream of being an RN, a reality? If this has any interest for you, you should go out and buy the Flight Nurse Bible, A Field Guide to Awesomeness by Robert P. Harris, BSN, RN, CFRN, CTRN, TCRN, CEN, CPEN, CNPT, CCRN. Here's Nurse Rob reading a selection from his book. You can also hear the full 2-part interview with Nurse Rob from Season 4, Episodes 2.1 and 2.2, published in December 2019 on the Real Talk School of Nursing podcast.
There are billions and billions of people on this beautiful blue planet, and we are all spinning through space together for the entire term of our short lives. These facts should not depress you or make you feel small. These facts should inspire and empower you to look around the world and see the many ways you can make a positive impact with your existence. If there is a greater purpose to life, it must be to serve one another passionately and alleviate suffering. We must also attempt to live as intelligently, courageously, and joyfully as possible. Semper Fi, blue skies, Vios Indios. Oh, and one more thing, no matter what you do not walk into a tail rotor.
Nurse Rob has a great preview on the book on Amazon.com, and you can connect with him directly on LinkedIn by searching for Robert P. Harris. Check him out. Check flight path.
You're listening to the Real Talk School of Nursing podcast.
I've never sworn before. Like, it's never happened. And I've never had to go back and erase any swear words in this podcast ever before. But seriously, so offline we were just talking before this, like, that there's something like 50 people or something like that who are actively practicing, who have the board certifications that Nurse Rob has. And it's like CEN, CPEN, CCRN, all the ones. Like, he's like, it's kind of an elite group of people. And I said, like, oh, okay, well, Nurse K, like, you need to go do that, because I think you could probably do that pretty easily. At least one of them for sure, and probably most of them probably fine. And she's, like, you have such a big brain. You seriously do.
Yeah, but I know I do stupid things all the time.
That
That was where the swear word came in.
What?
Sometimes I feel like I have a lot of brain and I have a lot of cognitive ability, but the little things, like I'll forget my keys and they'll be in my coat pocket.
Oh my God.
Or my
you're
sunglasses
human.
will be on my head. I know, but I feel really stupid when I do things like that. Because people have this expectation of me. And I guess I have the expectation of myself as well to not make those stupid mistakes.
But there are so many, there are so many nurses that I know, or not so many nurses, but there are a lot of nurses and there's a lot of docs that I know and be like, okay, well, I love you. I love working with you. You're fantastic. I would not trust you to watch a hamster. I wouldn't trust you to watch a goldfish over the weekend. But if I bring my kid in, my kid is in the best possible hands. But like, there's a great she's one of my favorite docs to work with. She's the total package in that she's compassionate and she's extremely intelligent and easy to work with and has great bedside manner and all of those things. But my God, I have to, if she has one of my patients, I am constantly going in the room behind her and getting her goddamn stethoscope and bringing it to her. And she'll literally she's walking to a patient's room and she'll see me walk by and grab mine off of my neck and be like, I don't know where mine is. I'm like, I just put it on your computer, lady. Oh my God. So yeah, you just need to go get the stuff. You are so ambitious.
That I am.
I think and I don't know if I haven't decided if you're to the level where you're overly ambitious or if you just don't have the time.
Well, I make as much time and create as much time as I can in a 24-hour day.
Maybe we should go see a psychiatrist instead of talking about working that particular thing out. So, okay. So let's talk about stuff inside of nursing school, because one of the things that I hear a lot from nursing students, especially, because the nursing profession is still dominated by, generically speaking, is still a female-dominated profession. And, childbearing and all that kind of stuff, and child rearing has a big part on the life of someone who wants to be a professional in any career field. It doesn't have to be nursing or otherwise. But you have this, but for any of you out there who have had multiples at the same time, it's not the same thing. My sister will be like, well, I've got 2 kids, that were born 15 months apart, so it's basically like twins. It's not. It is not. Belong to the parents of multiple groups and stuff like that, and I'm not trying to I feel like I should maybe put some violin music, but some sad violin music. Violin. Yeah, so I'm so the world's smallest violin is playing in the background for me. But it's not the same thing. Like we talk to these parents who they had twins and then they had a singleton, or they had a singleton and they had twins, and to a person, every single one of them are going, twins is completely different. It's not even close to the same thing. And being a dad going through nursing school was tough. And I can't imagine, but it's a whole different level of respect for someone who goes through nursing school and has twins at home and is a mom. But I get that kind of question a lot, is like, can you make it through nursing school and be a parent? And, because, or you'll get the nursing student they're in their first semester and, they're going through that nursing school culture shock.
Yeah.
And
yeah.
I wish you guys could see, I do have plans in the future for filming the podcast. I have this, psychotic drunken dream, where I imagine, a Joe Rogan type of podcast that's actually interesting to watch as well as listen to. But I wish you could have seen her. I wish you could have seen Kay's face when I just said the culture shock of school, and just the 1,000-yard stare, and like, yeah. It's a thing. It's a thing. But you get these students who are going through nursing school. They're facing the culture shock of that first semester, especially, and their parents, and they're just going, I feel so bad as a parent. Like, I feel like I'm a terrible parent. I'm not spending enough time with my kids and stuff like that. And we talk about sacrifice. I mean, sacrifice is a huge part of nursing school. It doesn't matter if you're a parent or a 18-year-old fresh out of high school person. You are going to have to sacrifice something to get through nursing school. There are obviously other schools that you have to go through where there's a lot of sacrifice involved as well, but for the sake of the podcast, since it's a nursing school podcast, there's a lot of sacrifice that's involved. So what was it like? How did you go through nursing school as a mom having twins at home? Like, how did you balance? Could you balance nursing school and being a parent, in addition to being, to having a full-time job and not a waitress or working as a CNA or an EMT? But I mean, like, you can't, working as a lawyer is,
Well, I guess
intense.
Yes, but so is working as a nurse. The intensity might be a little bit different, but depending on the kind of person you are, I am the kind of person that I find physical intensity to be much more desirable and rewarding than cognitive intensity. So I would much rather be on a nursing floor, running around, attending to patients, doing my day-to-day, than sitting in an office and, just brain melting at my desk the whole day and watching the clock tick by. So the combination of some desk work, some floor work has been really rewarding to me. But going back to Michael's comment about parenting and nursing school, I do have to admit that it was difficult. It was. We had some help. We had family that helped occasionally. And my children did have organized daycare that they went to 1 or 2 days a week. And so that provided me some time during the week to study or work. And then, like I said earlier, if I was home with them, I would try to just focus on my children for that time, be patient, even though my brain was screaming at me that I had this test in, 40 hours. And I only had 40 hours to study and do everything else in life before that exam that I needed to ace. So I just had to take a step back repeatedly and very often and say, look, my children are very important to me in my life. I chose nursing school so that I could have more time with my children. I chose the flexibility of a hybrid program. I'm going to be present with them right now, and I will study later. And it worked. And I don't know how better to describe it than that. You just have to compartmentalize and make it happen and make it work. And there were exams that I didn't do as well on as I wanted to, but I had spent the day with my children sledding in the snow or playing in the lake, and it was worth it.
So, can we talk about a little bit of life outside of school? Because the podcast focuses a lot on, the theme of the show when it was Ben and Greg in the early years of the podcast was the podcast is about all the things they don't teach you in nursing school, and I kind of extended that into, nursing school isn't just about learning content. You have to manage your life. It's time management, it's stress management, it's decision-making skills, it's, managing life outside of nursing school in order to allow you to complete nursing school. I've said it, 8 gazillion times. I'm even more sick of hearing it out of my own voice than you are, because it takes so many takes to get through the intro sometimes. But anyway, so tell me, how did you set up your life outside of nursing school that allowed you to get through nursing schools? You talked about having some family in the
Yes.
area. How important was having family support, or the support system, in order to make it through nursing school? Like level of importance.
The family support was important. I would put that pretty high on the list of importance. But I think more important than that was the time management piece. I needed to make sure that I had my children's care covered. I needed to make sure that I had my test study time covered. I needed to make sure that I had some time to eat and sleep and get a little bit of work in there. And at some point, I spent a lot of nights between 10 p.m. and 3 a.m. at our local diner with coffee and muffins. And that's how I did it. And then I would get up, I would go home, sleep a little bit, wake up the next morning. And that was part of my nursing school experience. But it was temporary. And I think that's what I kept telling myself. This is temporary. This is not forever. This is not medical school, 6, 7, 9, 10 years. This is 15 months, and I can do it. I missed out on my gym time. I'm kind of a gym rat. I like to lift and I like to run.
On top of everything else.
But I did. I missed out on some of that, and I really struggled with some of it. But again, I just told myself repeatedly, this is temporary. This is a temporary thing. It's a means to an end. I'm achieving some of the goals that I have for myself, and I can do this.
So what kind of things did you do outside of nursing school that kind of your hobbies, your other kind of stuff that kind of let you...
Nothing.
Well, but you know what I mean? Like the things that just helped you decompress a little bit, because,
Yeah.
I mean, there was a lot of times where I just, watching a half a movie. You could never watch a full.
No,
I couldn't watch a full
couldn't
movie,
either.
but sitting down and watching, like, I don't know, some show.
Yeah, what
some
were we
show
watching
or
on
some,
Netflix at the time?
or something like that. Like, what was the kind of things that you did in order to help you decompress from
Nurse
all the pressure?
Jackie. Michael, Nurse Jackie.
Okay.
That was part of it. I went home from nursing class and I studied, and then my husband got home and we watched Nurse Jackie. And that's what I did for 15 months. That or Grey's Anatomy.
That's just so you could pick out, like, well, no wonder Derek died.
He did the Whipple wrong.
The ET tube's like 5 centimeters in. He's not even... come on, guys. No. So how did you prepare yourself, or how did you study when you were within nursing school? I one of the things that I'm really passionate about is team building and teamwork, and as you found out in the profession, nursing is a team sport.
Absolutely.
You have to work well with others, and it doesn't matter if it's other nurses, if it's techs or CNAs, or other docs and stuff, physicians, because they, I mean, the oh my gosh, I wish, total aside, but there's we had to do this catheterization of this patient, and I had, and the patient was pediatric, a tiny pediatric patient, and we had to do a straight cath, and I had 2 or 3 experienced nurses come in and try. I tried. And then one of our docs came in, it was like, boop, like, oh my God. Just like, holy, so the level of people that I work with is insane, but you have to be able to work well with all of those. I'm very passionate about, and I was passionate about setting up like group study sessions and stuff. When I was in school, I was the person who's like, okay, well, I've set aside this study room, so I have the big whiteboards. I love big whiteboards.
I love big whiteboards too.
Yay! We could talk about whiteboards and
Whiteboards are
Excel.
life.
What about Excel spreadsheets? Do you like Excel
I do
spreadsheets?
like Excel spreadsheets.
Yes.
I tend to dig too deep into them, though. I like the whiteboard because you can be creative, and I'm a very visual person, so that helps. I can take that mind picture from that whiteboard and just vomit it out onto the exam.
Oh. But I would set up all these group study sessions and stuff like that, and have like I'm the person who brought the snacks and set it all up, and I'd draw. I'd have all the not the concept maps. I didn't really do things like that, but I would. But one of the things that I really loved about the big whiteboards is instead of on a sheet of paper or several, one slide where you're getting such a small snippet of information, the big whiteboard, you can kind of spread it out a little bit and then see a bigger picture.
Yes.
And that helped me. That helped me with the concept of things, the overall themes of knowledge, and then if that was up there, then my smarter classmates could come in and be like, not important, you forgot this, and I'd be like, oh yeah, and write that stuff in. But you can, that's the benefit of having somebody else's perspective come in a group study session where they can, where you can see something some way and then be like, I didn't think of it that way. That's really good. I hadn't considered it that way. Or I read this other book and, I have this, clinical pharmacology or pathophysiology book and it laid out this concept like this and it made it really easy for me. Or somebody else goes, I discovered this YouTube video, or whatever it is. And so you can kind of pool resources and kind of go, okay, I can 2 or 3 people can filter out stuff. You can separate the important from the non-important, which is almost impossible, I think, in nursing school, because I feel like they just go, at least in my program, it was, I made the mistake continually of saying, okay, this seems like this is a practical thing to know for nursing. But that's not where they're going to get questions. They're not going to take questions for what is practical for your career as nursing. They're going to take questions for wherever they can draw questions from. So everything was kind of equal. And having those friends there, having those study partners there, would kind of direct me in a way so I wasn't solely focused on the things that were practical, but some, and people would be like, I think you're missing this concept, or add this into this, or by grouping these two things together. I'm sure you're I wish I could have gone through nursing school with you. Because I just feel like, after all of our conversations and our friendship, that I feel like you're the type of person who could just link concepts together. And I had a lot of classmates who would be like, oh, this and this and this and this. And I'd be like, you just put all that together on the fly. You explained it to me and drew a picture and I still don't understand. But having that group study stuff, I think, is really valuable. And so I'm kind of passionate about that, and I've talked about it for like 4.5 minutes now, so sorry. But were you the study alone kind of person, or were you the group study person where you could just, you could lay out all your books on all the desks and have the big whiteboard? Like, how did you study in order to make sure that you made it through?
So I was a combination of the two. I'm a non-traditional student, so I had an immediate challenge with my classmates that I had children. Many of them did not have children.
Most of them didn't.
So
yeah.
I could not go to the study group, gossip for 2 hours, study for a half an hour, and then go to the bar. I couldn't do that. As much as I wanted to some days, I couldn't do that. So I tried some study groups initially with people that I just kind of resonated with.
But that's the thing, though, with the study groups. Like, you have to, the quickest way, if you want a study group, the fastest way to study, to eventually have to study alone, to learn how to study alone, is by having social hour.
Yes.
Or whatever, and I made that mistake. I probably, like, at the very beginning, because I would take these little mental breaks after about 45 minutes where I'm like, I just got to watch a dumb YouTube video or do some search on the internet for something and find a meme or some stupid funny thing, and then I can go back. But there are other people who were like, no, I'm here to study. I have this amount of time.
Yes.
And stuff like that. So I mean, that I think that's a great lesson to draw out, is that if you think you could benefit from a group study session, then the quickest way to find yourself studying alone is to not be focused and have a plan and stuff like that for studying, and make it into social hour, or to be, bitching about nursing school or instructors or anything else like that, because that's not helpful in that circumstances. You can complain as much as you want when and if you have the opportunity to go to the bar afterwards or whatever, but while you are with those other groups, make sure that you're staying focused, because otherwise you don't get people like Nurse K to come into your study group.
Well, I enjoyed the study groups where we could gossip and make light of nursing school and our instructors at times, and just live and just be. But I had a limited amount of time to study, as Michael said. And so what I had to do was find a couple of other like people who, whether they had children or not, they had time constrictions in their life that forced them to study at this point and this point and this point. And I found those people. And when I did study with the group, it was those people that I studied with. Nice. And we did well. And we did the whiteboard thing, and we did visual analysis, and we questioned each other. And really, for me, it's the team meeting of the minds sort of stuff that I thrive on. I want to talk back and forth about an issue that I maybe don't quite understand. And as Michael said, somebody will have this point, and then you connect it with the point that you have understood. And then all of a sudden the light bulb goes off, and you all understand everything. I did, however, study alone a lot too, and I am that person that needs a 8-foot by 4-foot desk and every single book laid out, and my highlighters and notes and typing on the computer and flashcards. And especially near the end of nursing school, there were a few days there that I spent 8-hour days in the library every day.
Oh yeah, for sure.
And when I was studying for the NCLEX, it was the same. And I could talk about the NCLEX and my studying for the NCLEX for an entire episode, because I have a lot of things that I drew from that as well.
Well, I think future episodes where Nurse K is our guest is probably in the works. Probably in the works. So let's take a quick break. We'll just take a quick break, throw another commercial in there, and then we'll come back and we'll talk about new grad and what your life was like after, and some of your experiences as a new grad when we come back.
Are you tired of the same old badge reel? Do you have to wear the same scrub color as everyone else? Are your undershirts boring and kinda stinky after wearing your lucky shirt through 5 in a row 12s? You can wear your personality in other ways. Go to badgeladybynerdwear.com and check out her massive selection. Tell her you're a Real Talk School of Nursing podcast listener and use the promo code REALTALK20 at checkout for 20% off your order. Expect 2 to 3 weeks for custom orders, and a few days depending on her actual job schedule, because she's a real nurse, to get your badges made and shipped. I know you'll treat her like your best friend at clinicals, so go to badgeladybynerdwear.com and order the coolest custom and original badge reels out there. Go to badgeladybynerdwear.com and use the promo code REALTALK20 for 20% off your order. That's badgeladybynerdwear.com. and use the promo code REALTALK20 for 20% off your order.
Okay, welcome back. So let's kind of slide into the new grad NCLEX stuff. We were talking offline a little bit about like NCLEX prep and how that affects your life.
Takes over your life?
Well, yeah. I was going to say it was like takes over. You don't have a life during NCLEX prep. I mean, because if you're doing it right, it's a very short amount of time that you have to review, 6 to 12 months of, or sorry, not 6 to 12 months, like 12, 16 to 48 months of material, for this test. And the thing is that we were talking a little bit about how our different experiences for the test, but walk me through what you did for NCLEX prep. What was your NCLEX prep routine kind of like?
Yeah. Well, our school provided an NCLEX prep course as part of the curriculum. You had to pay for it. You didn't have a choice. It was kind of shoved down our throat, and I did not resonate with it whatsoever.
Which one was it?
I can't remember what it was called right now.
Was it HESI, ATI?
It was
Kaplan?
ATI.
Oh, yeah.
I did not get it. It was not clear to me what they were trying to do. The instructors did try some of the whiteboard stuff, a lot of PowerPoints, and I was just sleeping through it, essentially. It was not clicking with me. And with each passing day of the ATI prep, I became more and more panicked, thinking, how am I going to consolidate this information? How am I going to get this for the NCLEX? How am I going to study? I didn't even like the ATI study curriculum.
Yeah, that was me. That was me in Kaplan. Kaplan was that way for me. It just never worked itself. It just didn't. I don't want to say it's a bad resource. I don't think it wasn't a good resource for me.
Yeah.
But like I can appreciate that other people used it successfully and stuff like that, but yeah, like you have to search around. I think there's a little bit of experimentation.
Yeah. What are the other prep courses that people can take?
Well,
Kaplan,
ATI, HESI is one.
Yeah.
I recommend and will continue to always recommend Mark Klimek. Listen to, I think it's episode, now I gotta look. Mark Klimek, we did the interviews in November or December last year, but it was episode 70, I think it was the 70 series, because I did 3 episodes with him. Hold on, guys. I'm getting through this. I'm gonna get it. So the Mark Klimek interviews were episode 22, 23, and 24 from season 3. So it's episode 70.1, 70.2, and 70.3 with Mark Klimek, and that was a really great series. So those were published in November of 2019. And if you have not listened to those, Mark Klimek is a fantastic resource. I cannot recommend Mark highly enough, and any of his instructors really, but Klimek Reviews is in my mind, they're not a sponsor. I use them. Went to the review. They are, in my mind, the best resource that is out there. So anyway, listen to those ones.
Yeah. UWorld was another one that
yes.
Going back to study partners and study groups, the study partner that I resonated best with, the one that I worked with the most, she used UWorld and she loved it. I didn't.
I have a very high opinion of UWorld's questions. Very, very high. I thought their questions were so. I had NRSNG, which is now nursing.com, still a friend of the show. They, we've kind of separated a little bit, but I'm still friends with John. But he's a great resource, and their SimClex is an absolutely fantastic resource for you if you're looking for something like that. So nursing.com, go to them. Mark Klimek is very good. Nursing.com or NRSNG, formerly known as the artist formerly known as NRSNG, I think their questions are really good, but they're not written in the same language. It's like reading a novel versus a technical manual, so their language is a little bit different. But UWorld, Kaplan's, their infallibility complex. Like, I think they should go see a therapist about their what's the I'm better than everybody else
narcissistic personality
Kaplan is
NPD.
very Kaplan is very narcissistic.
Kaplan resonated with me very well.
Oh, I couldn't take their. I would ask questions of their nursing of their, like one of the questions was like this, a Vietnam veteran has this and this and this and blah blah blah, and they're 40 years old, and I'm like, so this question has been around for like 35 years. It's a 35-year-old question. Not saying it's not valid, but I don't know, maybe an editor should
perhaps
update some stuff, or whatever it is. But UWorld, I have a very high opinion of their questions. I think the language that they use is very good. I think it's probably the closest ones of those practice tests that you can use, where the language is exactly like the test. But furthermore, I think one of the things that stands out in UWorld is they have a percentage on all their questions where it's like, okay, well, this is a question where 90% of people who answer this question answer it correctly.
Interesting.
So for example, if you get that question wrong, 90% of other people get that one right, you better understand why you got that wrong. That is the most important question for you to figure out why you got wrong. Because, the NCLEX isn't testing to see that you know everything. The NCLEX is testing to see if you know what everybody else knows. And if everybody else is answering this question at 90% and you get it wrong, you better have a very, very solid understanding of why that is. But I think UWorld was a really good resource. I'm really glad that Kaplan worked for you, because I was just I don't have experience with ATI, so it's good that it's good that I don't put down. Okay, that's not true. I put down Kaplan because I hated him. I hated him. I'm sorry, Kaplan. I know you're a good resource and lots of people have passed for you guys. I just did not like you guys.
Well, I think that's the beauty of having all of these other options.
Isn't that great, though?
I loved Kaplan. I hated ATI. I loved Kaplan. I had many classmates who loved ATI, did well with ATI. It just wasn't for me. I liked Kaplan. I can't even really extrapolate why and how I liked Kaplan so much. It worked for me. One thing that I guess I can pinpoint is I loved the test banks. I loved them. And I could I could take a formatted one that was pre-formatted, as a general NCLEX practice.
Mm-hmm.
And then I could find, through some analysis, I could find where I hadn't done as good as I had hoped. And then I could create an individualized test bank just on those format questions. And that really helped me narrow down where my weaknesses were, where my strengths were, and I think it helped me prep for the NCLEX a lot better. So that's why I liked Kaplan.
I had, I got really into Excel. I had this whole crazy Excel spreadsheet to kind of help me break down, because I thought that while Kaplan had a pretty decent breakdown of like the different areas of questions that they had, I felt like there was more analysis that was needed, and so being an Excel spreadsheet ninja, I made more, and it was pretty fun. It was fun and it was useful and stuff like that. But it's good to know that there are resources out there that I don't recommend that still work for other people. So if you are, and I think that should be a relief to you, is that you don't have to go out and get the same thing as everybody else does. If you feel confident using Kaplan, you feel confident using ATI, you feel confident, whatever, stick with it. Like, I think one of the worst things that people do is like when they get out and they spread themselves so thin over so many different resources. Did you do that? Did you do that in nursing school where you'd buy like extra books?
I didn't really, but only because I had had the experience of doing that in law school, and there were books that I never cracked and then couldn't return later. So I kind of learned my lesson the first time around, so to speak. But otherwise, I would be that kind of person that would purchase all of these extra materials and then not even end up having the time to use them.
Because there were a couple of things that I used, like I bought like a clinical patho book, and that was really nice because it was just a different take, and it was more practical. It was the practical side of things, that where the nursing textbook makes no separation between need to know, the three N's. The Mark Clement calls the three N's, the need to know, nice to know, and nuts to know stuff. That the textbooks never separate those things down because, well, they just don't. And I'm unfortunately, I'm too practical when it came to studying, and that was a downfall. I mean, that was not helpful in nursing school, because I said, I would go, well, this is a very rare side effect of said medication, or this is a very rare symptom of this condition or something like that. Well, if it's that rare, well, I guess I'm not really all that interested in making. I mean, it's nice to know, but maybe I need to prioritize knowing the stuff that okay, every single person who gets pregnant is going to have X. Like, this blood test is going to show like this. That is important to know, or everybody who gets this condition or has this medication, there's a high probability of having this, X symptom or something like that. And having that separation is really good. And that goes back to, the U-World thing, where it's like, okay, well, if 95% of other people get this question right and you get it wrong, you better understand why.
Yeah.
Why did you get this wrong? And if you get, I paid almost no attention to the questions where it was like, 20% of people get this question right, and I got it, or 20% of 20% of people got this question right, and I got it right. I don't care, because it's a passing level question, and that's great. But if I get it wrong, it's probably not going to affect me all that much, because I just need to, for the NCLEX, I just need to stay in the passing level questions and stuff like that. And we were talking about like how many SATA questions we had during the NCLEX, and
Yeah.
I think I kept track of them. I don't care anymore how many I had, but I had it was probably a third to half, I think, were of my questions were SATA, or select all that apply questions. And you think how many of yours were?
I would say in the low range, 90%.
So that's the brain power difference between us here?
No, I don't know. All I know is that I was just tragically furious during the entire exam. And I remember I was talking to Michael about this off the air, and I will never forget the feeling that I had. It was just this feeling of impending doom. You all know how that is. With each passing question, and everything was this SATA, select all that apply. And by question 50, I will never forget, I thought to myself, I have this inner monologue. There's a new blog post out there on somebody's blog that talks about some people have this inner monologue and some people don't. I definitely have it. I talk to myself all the time, out loud and in my brain. So here I am telling myself, inner monologue, if this does not shut off at 75, I am standing up and leaving. And I was just infuriated. With each passing question, more and more select all that apply, and the stupid thing shut off at 75. And I thought, I had to pause for a moment, and I thought, well, I either just failed miserably or I passed. And I left, and I was totally numb. And I did pass. But it was probably the most I have PTSD from the NCLEX. Still today.
Well, I think
It was
everybody
worse
does.
than the bar exam.
I think everybody who goes through. I mean, you're not unaffected when
No.
you go through the NCLEX. Everybody has some kind of emotional response to the NCLEX because you've been preparing. It's this monster on a hill. This test that everybody's warned you about for years, and it's this big thing. And if you don't pass it, I mean, it's not consequenceless. It's not like you can go back the next day and try to take the test. There's a minimum of 45 days. 45-day waiting period, cool-off period, if you will, that you have to sit and suffer through all of the test prep material again. But in my case, I mean, if you're listening to the program for the first time, I didn't pass my NCLEX the first time. And it was because I dug myself a hole at the very beginning. I and she's shaking her head at me like, I know, but
It's awful.
My biggest problem, the probably the personality trait of mine that has, it's a double-edged sword. Impatience is the double-edged sword for me because in my military career, impatience was the reason I was successful at everything I touch. I was King freaking Midas in the military because I was impatient, because I got stuff done, because I was impatient. In most circumstances, tactical patience and regular patience are very different things, but that's okay. But I digress. But I got through the I got into the tutorial, and I'm just like, I need to answer questions. Get me out of here. And it was, and that set the tone. I dug myself a hole that I couldn't get out of by question 75, and it shut off at 75. So I took the test twice. It shut off at 75 both times.
Oh.
But as far as the I mean, as far as the podcast and mentorship and stewardship goes, I couldn't have asked for a better thing to happen for me.
Right.
It totally sucks going back to family and friends and saying, I failed, and going back to your boss who had already hired you, had high expectations. Like, they certainly, yeah, that was bad. That kind of sucked. But I couldn't ask for anything better because of the things that I learned there. So let's take a quick break. So Kay can laugh at me for a little bit because I don't think you knew that.
I don't think I did either. No, I won't laugh though. I won't.
You can laugh.
Character building exercise.
It's okay. We can all laugh at Michael. It's all good. So let's take a quick break. We'll hear from one of our sponsors and come back and kind of wrap things up.
Sponsoring this segment of the Real Talk School of Nursing podcast is Mike and Bonnie's Snow Shovel and Driveway Salt Emporium. When the temperature drops fast and rain turns to ice in your driveway, which is then covered by 6 inches of snow, you need 2 things: snow shovels and driveway salt. Luckily, there's one place you can get both of those things. They have everything. They have all of your favorite trenchers, cleanouts, border spades, cap rocks, post hole diggers, grain scoops, and hand trowels. That's right. Everyone from the toddler in a sandbox to the fashionable urbanite and the sudden-hardened farmer. Mike and Bonnie's Snow Shovel and Driveway Salt Emporium can cover all of your scooping, transferring, farming, digging, and shoveling needs. So, stop by Mike and Bonnie's Snow Shovel and Driveway Salt Emporium off Route 44, where the only thing that's deeper than the holes you can dig with their great shovels is their discounts.
So we're what is this, like take 18 or something like that? I don't know. We're gonna have to cut it short. We got too chatty in our breaks and stuff like that. So we're gonna have to come back for another episode. Nurse Kay, I'd love to have you back for another episode. I feel like we have more to talk about.
I'd love to come back and talk again.
That'd be amazing. I think you have like so many relevant life lessons and life experiences that would be completely relevant to so many people who are out there. So let's come back. Let's do another episode at a later date. You know, she's got to go to work, like, because she actually makes money in her off time when she's not working as a nurse. I do have to work tonight too. But I wanted to take a second. I want to say that I've got a speaking engagement coming up on February 9th. I will be speaking at the 71st Annual Wisconsin Student Nurse Association Convention in Wisconsin Dells, Wisconsin. So if you just look up Glacier Canyon Lodge in Wisconsin Dells, I will be there February 9th. I think I'm speaking at about 9 o'clock in the morning. The rest of the convention is looking to be absolutely fantastic. There's a bunch of speakers there. It doesn't matter if you're in the state of Wisconsin. I'll be there visiting family and stuff like that. But you'll go to the conference. There's going to be lots of stuff going on. If you're not part of a student nurse association in your own state, I recommend you go and sign up for it. There's a lot of mentorship opportunities that are there, and to hear a lot of speakers and stuff like that. Coming up are the first of the last 3 Yeti giveaways. We've got the Yeti Hopper Flip 8, the Yeti Hopper Flip 12, and the Yeti Camino bag that are coming up. So make sure that you are paying attention to posts. I'll post the rules and stuff like that. Again, Facebook is making it complicated because it's Facebook. Thanks, Mark Zuckerberg, you fantastic human being. I love you so much for all the great things that you are doing. Anyway, so keep an eye out for those posts, and we'll do the giveaway. I'll post all the rules. I'm not going to specify them now. So love you guys. I'll talk to you later. Let's do it again soon.
This Real Talk School of Nursing podcast is a Real Talk production. This podcast is dedicated in loving memory of my brother, First Lieutenant Justin Smith, Blood and Steel.
Sic semper tyrannis, facta non verba.
Good night, Steve Cannon, wherever you are. Annyeong kasayo. Now you go home.
If you like the show, you can support us directly at www.patreon.com/realtalknursing and gain benefits such as early content, shout-outs, special swag, and more. You should write in to realtalknursing@gmail.com or use Facebook Messenger or contact us through Instagram or Twitter to share your experiences, ask questions, and give your feedback. Thank you for supporting our friends, affiliates, and sponsors. Thank you as well to everyone who started following us on Instagram, Twitter, and Facebook. More listeners means more and better shows. Make sure to share the show with your classmates and especially those underclassmen. Let's give a hand up to those who are coming behind us. If you're new, welcome to our community of fun, engaged, and supportive nursing students and nurses. Don't forget to reach out and tell us if you have any announcements for graduations, good grades, difficult tests, friends you want to congratulate, and your announcement will be featured on our show. If you like the show, the Real Talk School of Nursing podcast is available on iTunes, Google Play, iHeartRadio, Libsyn Web Player, Stitcher, YouTube, Spotify, and SoundCloud. So, go to wherever you download podcasts, subscribe, rate us, review us, write into the show, and smash that subscribe button. Remember, leave only 5-star reviews because that's the only ratings that count to get us noticed by more nursing students.
The Real Talk School of Nursing podcast is a holy moly, I can't believe you're still listening to this podcast.